packed and loaded as the first shipments of the Pfizer vaccine make their way to hospitals across the country.
We'll be having vaccines coming in throughout the whole week.
With the Pfizer vaccine approved by the FDA, Chris Arisman, the Director of Infectious Disease for the Minnesota Department of Health, says the next step, waiting for guidance from the Advisory Committee on Immunization Practices, also known as the ACIP.
To give specifics about not only storage and handling, but who specifically should get the vaccine. Were there any medical conditions that would mean that someone shouldn't receive the vaccine?
According to the Chief Operating Officer of Operation Warp Speed, the vaccines are expected to be delivered to 636 predetermined locations nationwide within 24 hours. Arisman says MDH is preparing to train providers on how to administer the vaccine safely.
There'll be provider training from our team. We have a 20-page guidebook for those who'll be vaccinating.
In Phase 1, Governor Tim Walz announced the vaccine will go to frontline healthcare workers and long-term care facilities.
That's a huge area that I hope they are allocating a huge chunk of those vaccines for.
With close to 3 million doses expected to be distributed nationwide, Arisman says vaccinations can start as soon as training is completed.
Our goal is a safe vaccine for Minnesota.
In Minneapolis, Charmaine Nero, KARE 11 News.